I'm glad to see you, and thank you for taking time out of your obviously busy schedule to, bring the story of what is going on for nurses to the audience. I really appreciate that.
No problem. Yeah, I mean, it's something that I'm really happy to do. I think I can't say in this day and age it's an underreported story what's happening in the hospitals. I think we've been getting a good amount of attention, but I think it's something that I think never can't get enough attention right now, and so I'm very happy to do what I can in that regard.
So, Sean, you are exposed to sick people with the virus constantly. We're speaking with Sean Petty. He's a registered nurse and an elected member of the statewide board of directors of the New York State Nurses Association. He's here to talk about how nurses are risking their lives for the health of their patients and what we can do to support them. Again, thanks again for joining us. Can you talk about your job right now? How often are you treating patients who are infected with the coronavirus?
I mean, daily. I mean, and we work 12-hour shifts. There's not a, you know, there's not an hour that goes by that we're not um, exposed to, patients with coronavirus. I mean, the way the virus works is that, it's no telling how and to what extent the virus is being emitted from humans. So whether you're asymptomatic, whether you're symptomatic, whether you're at different stages of the disease process that can last weeks, your body in various ways can be shedding the virus into the atmosphere
Mm.
and onto surfaces. So we're and obviously in hospitals and in emergency rooms in particular, we're concentrating you know those humans, and we're doing our best to treat them and keep them alive. So yeah, I mean, in an emergency room, in my pediatric emergency room, children are not the people who are primarily getting very ill or dying from this disease, but they are widely known to be extensive carriers of the disease. And so we're constantly exposed, and my side. And then within the last week we've also been boarding, um sorry, little
Oh,
noise
that's
in
okay.
my house. We're constantly boarding, or we're for the last week we've been boarding adult patients who are waiting for beds in our hospital because we're out of beds and the adult emergency room is backed up by about between 40 and 60 patients,
Wow.
waiting for waiting for beds either in our hospital or waiting for beds in the Javits Center, which is a makeshift hospital in New York, or the ship, the Comfort. um, those are facilities that have been at this point underutilized. There's only, I think, out of the 1,000 beds at the Javits Center, there's only a couple hundred that have been utilized.
Mm.
So there's a bottleneck getting patients from the hospitals out into those facilities. So that has a direct result in terms of us boarding between 5 and 10 patients in my emergency room on the pediatric side. And basically, I've never treated an adult patient in my career. I've been a pediatric nurse for 12 years. I'm a pediatric trauma nurse.
Mm.
But I've been taking care of 40 and 60-year-old patients with all kinds of comorbidities that I'm not familiar with, and needing all kinds of medications that I'm not familiar with. So, and I consider
Wow.
myself one of the fortunate ones. Like
Mm.
so many of my colleagues, most of my colleagues are in far more precarious situations.
Um, it's just hard to imagine it. First of all, it's wonderful that you're there because if they threw me in there and I wouldn't know what I was doing at all. So at least you have some, background in education. But can you talk about what it is to have people who just, are unfamiliar with the diseases that they're being faced with, whether it's COVID or whether you're working on, other comorbidities, as you said. What effect does that take on the nurses personally?
I mean, it adds to the layer of fear. I mean, you're already walking into a situation where you know that essentially you're being surrounded by what, you know, is poisonous gas, like, you know, a cloud of poison is one way I've described it. Um,
Wow.
Especially in the emergency room setting, and especially in our on our adult side. I mean, for most of this time, we haven't had enough, you know, physical rooms to keep patients in. So patients are in the hallways on stretchers, and so there's no ability to contain the, you know, the
The virus.
aerosolized particles that are
Mhm.
being emitted by these patients, you know, with COVID. So so it's literally, you know, invisible clouds of poison that are that if you know the science and if you know the disease process, that's what you're envisioning as you're walking around. And
Ugh.
so not only are you not only is that the baseline situation, then you're layering in, you know, the fear of exactly how this disease impacts people, which is that it can go from zero to dead, in terms of danger, in a matter of hours.
Wow.
And so, you know, you can have a patient who's maybe got a little cough, has normal oxygen, is not having difficulty breathing significantly, um, to them, you know, crashing a few hours later. So knowing those two things, and then on top of that, treating people that you're not familiar with. I don't have any idea whether or not my patient with pulmonary hypertension makes them more at risk for being one of those patients. I don't have any idea. Then we didn't, and that with the one particular patient I'm thinking of, we didn't have the medication, that she takes at home. She wasn't able to bring her medications from home. There was a specialized medication for pulmonary hypertension. We weren't able to provide that medication. We were scrambling with our medical team to figure out what would be a good substitute. Um, and I have no idea whether or not that situation is going to put her life in significantly more danger. So yeah, it's obviously a level of fear, a level of unfamiliarity in an already radically unfamiliar situation. And you know, it's rough. It's rough.
Sean, we
And
were
again,
talking.
for one of the most, what I again consider myself one of the most fortunate people in my hospital.
Mm.
And yeah, and
We were talking before this about whether families are consulted when it comes to intubating. Um, is there time to check for the DNR? And then what happens after a patient actually passes away? Are I'm
well,
assuming you're so short-staffed that you really just have to do what you think is best in the moment.
yeah, I mean, there with intubation would be different than DNR. I mean, um, intubating, there no, there's no time to consult anybody about intubation, because when that decision is made, it's made on the basis of there really aren't any other options for keeping this person, you know, what we call ventilated, getting enough oxygen forced into their lungs, to be able to keep their body, you know, stable. So we're, you know, there really isn't a an ability to consult families or patients about intubation. Um, in terms of do not resuscitate, thankfully, we were really worried at the beginning of this crisis about some of the profound ethical dilemmas around. There was talk about across the board DNR orders. There was all number of discussions. We didn't. I don't believe we got to that point. Although I can't say for sure because I'm not. I wasn't. I'm not taking care of a quantity of patients in those exact situations. Those are more happening in the adult emergency room and on the ICUs. Um, but my understanding is we didn't get to the point where we had to implement across the board DNRs. The point
Some
we,
people just have DNRs that they don't want
yeah,
intubation already. Like a DNR is a
that's
do
true.
not resuscitate order saying these are things I want and these are things I don't want. And
Yep.
I'm just imagining that there's no time to check.
Yeah, unless they come in with that attached to their chest, you
Right.
know, unless they come in with that already in their medical record. Yeah, and then or unless the family has paperwork or the family has, you know, it's coming in
Right.
with that explicit information. Yeah, no, and then we have to do just
Sure.
whatever our guidelines are and whatever
Mhm.
we normally do in that situation.
Sure.
The big problem in terms of these ethical dilemmas and the policies that have been implemented, the I think the most significant thing that needs to be highlighted in this crisis is that has to do with EMS, and
Mm.
there's a widespread there was a across the board policy that ambulance workers cannot bring a patient into the hospital without a heartbeat. Essentially, if the patient goes into cardiac arrest at home or in the field and
Mhm.
they can't get a heartbeat back, they cannot bring that person to the hospital, and
Mm.
that's a radical departure for a medical system that's used to being able to do everything it can to save a life, and that's something where there could have been maybe a percentage of those people that were saved. It's going to be a low percentage under typical times, um, but there could have been an ability to save some of those people if the system had the capacity to not make that rule, but it did not.
You've been a longtime union activist. Can you talk about what do you think the federal and local government needs to do to help frontline workers like you and the other nurses?
Yeah, I mean, there was just profoundly poor planning at every stage of this process, brought to us by a healthcare system that was basically run in a basically constructed in a very cost contained environment. Essentially, we're going into this situation with a healthcare non-system uh, that sets things up to have just enough to take care of the patients that exist in a given moment. So the bare bones staffing, the bare bones number of beds, the bare bones facility, and of course all of those are conditioned by race and class.
Mm.
um, but I think that what the some of the very simple things that could have been done and can still be done are mobilizing at the federal level the Defense Production Act to produce massive amounts of PPE. Um,
Do you have enough at your personal hospital? I mean, I'm assuming there's never enough. Wouldn't you just want a stockpile that
no,
seems
yeah,
like it
no,
could
there's
go
never enough.
forever?
I mean, and if this were, I contrast it to how we were able to deal with Ebola, which our flagship hospital in the public system, Bellevue Hospital, when we treated the first Ebola patient, it was all hands on deck, and they were able to rotate nurses. Nurses got full training, full PPE. It was done rapidly. It was done effectively. Um, and we had the know-how to be able to do that. But I mean, yes, there should be stacks of N95s in every department in every hospital in this city. There are not. They're rationing those. They're telling non emergency room nurses that and non ICU nurses that they have to save one N95 for an entire week, and
Ugh.
ration them out and discouraging their use and encouraging their reuse. Um, there should be stacks of, I mean, just this week we got impermeable disposable gowns for the first time. Like
Wow.
it's
It's been a month. Oh my God.
yeah. Before we had permeable, light gowns, um, that um, and even those were sparingly distributed throughout the hospital. um
Sean, are there
it's
any services for nurses? We have a question coming in from our stream
sure.
chat. How are the nurses holding up mentally, being on the front lines like this? Do they at least get some sort of counseling or support?
Yeah, thankfully, I mean, not there's a bit of a contrast between how the hospitals are dealing with it and how the union's dealing with it. The union has always had a number of different programs and organizations that it works with to help with the mental health care needs of our nurses. And in this crisis, it's one of the first things we were able to implement, is a nurse assistance program for mental and emotional health. The hospital has like a quiet room with some essential oils in it that you can go to and
Cry.
hang
Is
out
there
with for a
Kleenex?
while when you're
Is there
but
Yeah,
but the union has standby counselors and support groups and a whole range of services that we're trying to get out to our nurses who need this. But for most of us, there's very little time for mental health. Unfortunately, I
sure.
mean, it's kind of like we have the mentality of, we'll cry our eyes out when this is all
At
over.
the end.
So right
Right.
now, it's time to grin and bear it.
Yes, that's the nature of trauma, isn't it? Pull
Yeah,
it, get through the trauma and then process it later.
right.
Yes. Oh, is there anything that you think that it would be helpful for our viewers to know, both about the importance of unions at this point in time, and what else? What do you think is important for our viewers to know? Things that are happening in the hospital, things that are happening in the union. I'm going to just open it up for you to
Sure.
answer as you see
Well,
fit.
I think the main thing that I've really been thinking about and trying to grapple with in the last week, as we start to reach the apex of this crisis and getting we're getting to the top of the mountain, and so it's a little bit easier to see the valley and see the what's going to be coming down the pipe in the next 2 weeks, the next month, the next 2 months. And I think it's important for all of us to understand that we're in all likelihood going to be facing a full scale economic depression, um, and that's going to change everything, and that the hope of all of us that we can at some point go back to normal, is really a false hope, unfortunately, and
I'm
that
afraid
there
that
is
way
not going
too.
to be back to normal after this. And that necessitates us changing the way we think about our relationship to our employers and our political systems. And what we're going to be facing is the profound contradiction of the fact that we've just gone through the most significant public health crisis in probably the last 100 years. The system that we're supposed to be able to protect us. We live in the richest country in the history of the world, and the systems that were supposed to protect us and guide us through this crisis were complete failures. And there's not going to be any lessons learned on that, economically and politically. That there are, in the middle of this crisis, our supposed hero Governor Cuomo and our Mayor De Blasio, who have been, you know, running the helm of our city and state through this crisis, are in the middle of this crisis proposing budgets that slash education and healthcare. Um,
Why are they
we,
doing that? Don't they think we're not going to know? They think we're not going to notice?
well, I think that's part of it. I think it's part of what Naomi Klein calls a little bit of like shock doctrine capitalism. That it's easier to slip it under the rug when people are distracted.
Hmm.
Um, but I think also they're trying to. I also think that they feel that they don't have a choice, because of the economic devastation that has been wrought.
What
But
about raising taxes on the filthy rich? What
well,
about
that was
that?
going to be my next line. That's the political Rubicon that they are unwilling to cross, that we need to force them to cross. That
Hmm.
they won't cross on their own um, on their own terms. They've refused to cross it in the past, and they're refusing to cross it now, which is insane, right? You still have hedge fund billionaires. You still have literally hundreds, if not 1,000 billionaires in this country who have been looting coffers of of ordinary people for decades. And even in an economic depression, you still have the policies that are protecting those people and shielding those people. I mean, the federal stimulus package was a textbook case of massive amounts of tax money, but also just printed money. Also, just
Just,
borrowed and printed money. They can print money to keep corporations rich,
ugh.
but
Why
um,
can't they just print some additional money to make us okay? I don't get that at all.
they could, they
How
could,
long do they think this is going
they
to
actually
happen?
could.
Well, that's true too.
No,
True
they
too.
could do that, but but and it's emblematic of just so much about what's being exposed about our society right now. That money is a fiction. That money is this social construct that is determined by the people in power.
Mm.
in other words, um, and that this whole thing about this, and I think that's the thing that I really want people to understand is that this is so much is being exposed about the inner workings of our society, and that but that also the main thing that's one of the main things being exposed is who is essential and who isn't. um, we are the essential workers, healthcare workers, housekeepers, grocery store workers, the people that are actually make this society function.
Care workers, as we call them.
Absolutely.
Yeah.
And then also the hidden work of the home, what some
Mhm.
people call social reproduction.
Thank
Um,
you. Yeah,
yeah,
I'm about to go do
that's
that for
being,
6 hours after
yeah,
this.
I mean, exactly. And the fact that all the kids are now, out of school
They're
and
at
in the
home.
house, and we're doing all the education work at the same time, along with
Mhm.
the teachers who are also at home caring for their own kids and trying to help educate our children as well. So it's all of that essential work is being revealed as such, and we have to really take that to heart and use that as our key source of power.
I have
um,
a slight problem because I'm like, well, I already knew that, but is this is this seeping into places that didn't know it? Are you getting a sense of that?
yes, I mean, I think I am, and then I think you can see that through, I think, what's happened in the last week or two with the series of very spontaneous wildcat actions in all manner of workplaces, Amazon workplaces, Instacart. People are getting a sense of their own power, their own economic leverage, their own level of their own understanding of them being essential, and how that contrasts with how they're being treated.
Mhm.
um, and using that leverage to earn their dignity in this society, to reveal and to fight for their dignity and their protection. And what I think we need, the people that have known that for a while and the people that are organized in various ways need to do, is figure out how to increase that level of organization of those people in this moment. And I think we can do that in unprecedented ways. I just think we have to set ourselves up. I think the election of the election period of the last 6 months has given us a great hope, in the sense that the popularity of Bernie Sanders has shown that millions of people are open to these ideas, are open to this idea of economic democracy, of wealth redistribution, of power of ordinary people. And that's going into a new phase that I think is going to be higher stakes for us. But I think we have to pivot from the idea that this is going to be happening at the federal electoral level, and it needs to now happen in the streets and in workplaces. And
Oh,
we need to use the same level of energy and organization that we put towards projecting those ideas through an election. We need to transition from that into that kind of organization at the grassroots.
we're speaking with Sean Petty of the New York State Nurses Association and the Democratic Socialists of America. Sean, both a question from the chat and a question that I had myself from Corvus Ursa. Is there anything we can do for our local hospital workers to help them?
Yeah, I mean, I it's been so amazing to feel the solidarity of people through all these different projects, the homemade masks, a neighbor, dropped off 10 N95s at my doorstep the other day. People, ever since our struggles have been getting some publicity, people have been reaching out to us, asking what they can do. Those are incredibly, they bolster your spirit, as does the handmade signs posted on our hospital walls. We support healthcare workers, the claps at 7 o'clock, all of that stuff is really important and a really great thing to be doing collectively for healthcare workers and all essential workers. um, I think, though, that the main thing that we need to try to do right now is figure out how to take on the politics of this thing.
Mm.
I think that this is now primarily shifting from a mutual aid type of phase of our experience, and more shifting towards what's going to be coming down the pipe politically. And that is radical budget cuts, which, need to go in the polar opposite direction. We need to be tripling and quadrupling the funding for these services, not cutting them by half.
Oy.
So I think that we have to move into a more acutely political phase of our struggle, and I think that's what I'm going to be looking to do in terms of organizing actions at the hospital, organizing actions across different healthcare, the healthcare system, and in solidarity with other people who are doing the same. I think it's going to be a combination. There's going to be a combination of direct struggles for PPE, direct struggles against, for increasing hospital capacity. There's still going to be a need for that, and we're still going to be fighting for that. So I think it's going to be more along the lines of supporting the struggles that do happen, spreading the message about the nature of this. But I think we need to start to get, we need to write more.
It is
We need to
shockingly
organize.
cavalier that Trump's attitude about PPE is like, oh, I'm just going to hoard some up for us at the federal level and just let nurses die. This
Yep.
just seems insane.
Yeah. No, the message that when being inspired from the Black Lives Matter movement to weaponize that slogan of early on of nurse lives matter. I mean, people really felt that. I mean, because it was so, we felt so, it's this bizarre contradiction, right? It's like everybody is telling us we're so valued, we're so essential, but in the
But
same breath,
no mask for you.
right? But then the same breath, and it is this weird thing. It's like you're a hero, you're a hero. Oh, am I a hero because I'm gonna die for this, you know, for this struggle, or am I a hero because you want me to live? And it's just, and it is a very bizarre message, and it's one message coming from ordinary people and another message coming from the people in power, right? And so I think that's um it's very very bizarre and traumatic to walk that contradiction right now. But I think that um yeah, I it is criminal. I mean, Trump's decisions to not come hell or high water, figure out a way to get widespread testing, not figure out a way to stockpile PPE. Those two decisions in and of themselves are worse than anything that any decision that any other president's made since Vietnam.
Mm.
Um, I think that we're talking about death on the scale of unnecessary death on the scale of hundreds of thousands of people over a very short period of time. It took, 15 years for 40,000 people to die, 50 plus thousand people to die in Vietnam. It's going to take 3 months or 4 months for 100,000 people to die in the COVID crisis.
Ugh.
And
We need to
it's,
draw that parallel over and over.
yeah, absolutely. And this is, I mean, all you have to do is compare what South Korea did, which got the first death on the same day that the US did, and what the United States did and did not do. Widespread testing, full PPE for healthcare workers, build up hospital capacity, have a national healthcare system to coordinate it.
And
Boom. Like those four things.
what would you as a nurse say to those people who want to hold Easter Sunday services en masse?
I'd say that's a profound and deadly public health disaster. I think that, you know, I think that there's all kinds of understandable reactions to this crisis. People want solace. People want community.
I'm pretty
People.
sure actual Jesus said, "Don't." There's
Okay.
no public prayer. You should go in your
Yeah.
closet and pray
Right.
silently. And yet, no one. They only pay attention. Sorry to go here, but they
No,
only
totally.
pay attention to the things they want to pay attention to. No public prayer means
Right.
no public prayer. Maybe he saw the coronavirus coming.
I agree. Well, I think that, like just like the hedge fund managers, leaders of churches are small businesses, right?
Ah, yep.
They're
Here we go. That's
they're
right.
people that that depend on, donations, from their constituents every week, and they're going to go bankrupt just like a small business is when they don't have their customers. The problem is they have a profound tool at their disposal, an ideological and spiritual tool at their disposal to convince large numbers of people that this is a hoax and this is not something to be taken seriously.
Mm.
And that decision is gonna, you know, and they're these leaders are making similar decisions. They're making decisions like the Bridgestone Firestone executives made when they decided to ignore, safety mechanisms in their tires, which killed,
Yes.
several thousand people very knowingly. And they said, well, and the
Ah,
internal memos of that, scandal said, well, it's gonna cost more money to fix those tires than it is to pay out the wrongful death claims from the people that die. So we're not going to fix the tires, and we're going to let people die. And I think that's the same calculation that these church leaders are making. It's the same calculations that Trump is making, and it's the same
seems like it's the
calculations
same
that these
calculation that always fits in there is like, well, but it won't happen to someone I know. And what I saw with President Trump is, oh, someone I know has it and is very ill when his friend got it. I mean, it didn't change his, certainly changed his behavior for about 5 minutes. And then
Sure.
it didn't change any real thing that he did. He still, yeah,
Well, Trump, yeah, I mean, the
no good.
psychodynamics of Trump are a daily grappling. So, there's
Sean,
always
thank you for staying on with us so long. I really appreciate it. I know I kept you over
oh,
your time that we suggested,
okay.
and I know that you're probably pretty busy. So I do want to just say a heartfelt thank you for risking your life to save the lives of others. It's not every day that I get to say that to someone. Um, and
Every day I
and
get to
please
do it.
pass that on to the rest of the nurses.
I will, and that's always very much appreciated. And
We
yeah,
will be supporting you on Twitter by but more than just fucking Twitter. When there's a protest at the hospital,
there
we
we
will
go.
get our PPEs and show up and stand 6 feet away from you.
Wonderful. That's the best we can ask, and we really appreciate it.
Twitter is at New York Nurses, NY Nurses. We're talking with Sean Petty, a pediatric emergency room nurse at a public hospital here in the Bronx. Recently joined the New York City Labor Branch of the Democratic Socialists of America, is on the statewide board of directors at the New York State Nurses Association, and the vice president of New York State Nurses Association at your hospital. You're a very busy person. So thanks a lot for taking the time to speak with us today. I really appreciate it.
Thank you. It's great talking.
Good luck to you.